Well, you may not realize this, but diabetes causes more deaths per year than breast cancer and AIDS combined. That's according to research from the American Diabetes Association. But getting rid of diabetes may be an option for some people.
Carolyn Williams says she no longer suffers from the disease thanks to surgery done by Dr. Sunil Sharma of New Life Bariatric Associates. And Dr. Sharma, we're going to get into the science behind all of this in a second and talking about this cure for type 2 diabetes. But first, Carolyn, let's bring you into the conversation and talk about your story. And let's talk about how this affected you, this surgery, and talk about your struggle that you had with diabetes even before you had the surgery.
Okay. I've been struggling with diabetes probably for the last 10 years and had gotten to the point where I was having to take a lot of insulin every day, metformin every day. It was affecting my eyesight as well as my blood pressure, my sleep apnea. So I knew that it was something that I needed to get under control so that I could have a long-lasting life.
And that's what made you go then see Dr. Sharma. You had this surgery. Talk about how you're doing now and what a change this had for you. It cured you of your diabetes.
Within 3 days. I had it on December 23rd and left the hospital. When I went into the surgery, my blood sugars were over 200. By the time I left the hospital that Friday on the 26th, it was down into the 90s.
So for those at home who may not know, what is the surgery that Carolyn had? Because they may be living with the same condition. What was the surgery that you had from Dr. Sharma?
I had the duodenal switch, which has been performed since 1983. It's not the gastric bypass or the sleeve. It has the highest cure rate for diabetes. It does have a 98% cure rate for diabetes, whereas the gastric bypass only is an 84% cure rate for diabetes.
And Dr. Sharma, let's bring you in on this conversation and talk about the science behind it, because in the commercial break we were just talking about how many millions of Americans are affected with type 2 diabetes, and you were able to cure Carolyn of her diabetes. How is this possible? Kind of elaborate on the surgery that she was talking about.
Yeah, this is a most recent addition duodenal switch, and we are one of the few centers in the country who do it laparoscopic. Most effective for curing the diabetes. And when I say cure, meaning no insulin, no oral medications, regular diet, and your sugar is less than 110. That's how we define cure. And it has a very high success rate doing the duodenal switch.
I'm just imagining that people are hearing Carolyn's story and thinking that could be me, and I need to call Dr. Sharma. But are there particular candidates for this surgery, folks that should be calling you because they're experiencing certain things?
Yes, there are two types of diabetes, type 1 and type 2. So if you have diabetes and you have overweight or have obesity, we call it diabesity, diabetes and obesity, then you can be a potential candidate for the surgery and you can get rid of this deadly disease.
Let's talk about how many of these surgeries that you have done. I know Karen is just one example of this.
Well, I've been doing metabolic surgery for more than 10 years, and in 2003, when I was in Pittsburgh, we published the first landmark paper suggesting that diabetes can be cured. And since then, I have done a few thousand surgeries, all different kind of surgeries. Duodenal switch is the just recent addition to the spectrum of surgeries we performed. And depending on how long the duration of diabetes, how complex it is, many patients who are very severe diabetes requires pump. This is the ideal operation.
And the results, Carolyn said she was cured of her diabetes within 3 days, which is incredible after years of dealing with type 2 diabetes. 3 days, is that typical?
Yes, the cure of diabetes is unrelated to weight loss, because weight loss will require 12 to 18 months. But the cure of diabetes is instantaneous. So most of the time they come, they are on insulin. Many of the patients are insulin pump and their sugar is running 250, 300. And when they go home, they say goodbye to diabetes.
Wow.
It's amazing.
It really is amazing.
Carolyn, what advice would you have for somebody who may be listening at home and hearing all of this and thinking that this potentially could be a solution that would change their life forever? What would you tell them?
To do some research, actually. Go on to dsfacts.com. Also call and schedule an appointment with Dr. Sharma to come in to meet with him so he can explain the surgery. But just to know what the surgery is all about and what you will have to go through after the surgery. It is a tool, but you have to be able to use that tool successfully. And knowing how to use the tool through his guidance is really the best thing for you to know ahead of time.
And we have to go, but Dr. Sharma, how important is it that they stay on track with you after the surgery to make sure that there is a continued success?
Yes, I think it's just not simple surgery. It's a very extensive surgery. They need to get educated what it takes to make it successful, because once you have the surgery, you have taken the risk, it should be successful for the rest of the life. That's the
Right.
key. So you require support group, frequent checkup and follow-up, and follow the guidelines.
Great news.
Carolyn, congratulations with
Thank you.
everything. And Dr. Sharma, to you as well for bringing this surgery to Jacksonville.
Thank you so much.
Appreciate
Yes.
it. And we'd like to thank New Life Bariatric Associates for sponsoring the segment. For more information, you can visit www.newlifejax.com. And to schedule an appointment or to get a complimentary weight loss evaluation, you can call the number which is there on your screen, 904-399-4004.